Hello, my name is Stella Schuster. I am undergraduate research student at EINTI Research Group. I'm advised by Professor Dr. Carolina Camargo de Oliveira. I am supported by a scholarship by the National Council for Scientific and Technological Development, CNPq. My project is titled Biosensor Development and Evaluation for SARS-CoV-2 Active Infection Detection. The COVID-19 pandemic was responsible for over 700 million cases and almost 7 million deaths worldwide since 2020, according to the World Health Organization. From the beginning, diagnosis has been fundamental for pandemic control. Among the most employed diagnostic methods for SARS-CoV-2 active infection detection are real-time quantitative PCR, the gold standard molecular biology technique, and rapid antigen detection tests, which show low sensitivity despite being accessible. The gold standard, although sensitive and specific, requires expensive equipment and highly trained professionals. Also, it is time-consuming, with an average of 3 days until results. Therefore, the development of new methodologies for rapid diagnosis remains an important strategy to mitigate virus transmission risks, a still relevant topic given the need for quick results, and variants of concern, which have high transmission rates and high immune evasion capability. So, our objective was to develop an electrochemical biosensor as a rapid test with higher sensitivity for SARS-CoV-2 active infection detection by detecting the RBD protein. The biosensor was developed from a screen-printed electrode modified with polypyrrole nanotubes and nickel hydroxide by electrochemical deposition. 3 different biomolecules were employed and tested: 2 commercial IgG monoclonal antibodies and VHH antibody fragment SB15, all containing his tag. The biomolecules were mobilized in an oriented manner by affinity between nickel and histidine. To evaluate the biosensor performance, an analytical curve with different concentrations of the RBD protein in solution was produced. Also, the biosensor was tested with real patient saliva. Electrochemical impedance spectroscopy was employed for detection for its advantages such as high sensitivity. Here, the charge transfer resistance parameter increment is proportional to the analyte concentration in the sample. The biosensor was characterized by scanning electron microscopy and electrochemical measurements. For the analytical curves, a linear detection range of 0.05 nanograms per milliliter to 10 nanograms per milliliter and 0.01 nanograms per milliliter to 5 nanograms per milliliter was obtained for MABI 10540 and MABI 105802, respectively. A linear detection range of 0.01 picograms per milliliter to 50 picograms per milliliter was obtained for SB15, which is the lowest limit of quantification achieved. The VHH is smaller compared to the monoclonal antibodies, which allows for more surface to interact with the antigen, and therefore higher sensitivity. And since it is a simpler structure, it can be produced in prokaryotic expression systems, which are cheaper and have higher protein yields. 22 saliva samples pre-characterized by RT-qPCR were tested, where 7 were negative samples, 10 were Omicron variant positive samples, and 5 were Delta variant positive samples. The statistical analysis showed a 93% sensitivity, a 95% accuracy, and 100% specificity for the SB15, which are satisfactory results according to the World Health Organization parameters for rapid tests. For characterization, SEM images show that the materials were successfully deposited on the electrode surface. In A, we can see the polypyrrole nanotubes, and in B, we can see the nickel hydroxide thin nanofix layer on top of the nanotubes. The developed biosensor employs cost-effective and biocompatible materials, little explored in the field of biosensors, innovative biomolecules, and powerful electrochemical techniques. Because of that, it was able to differentiate positive from negative samples comparably to the gold standard in 15 minutes. A low limit of quantification was achieved as well, which means it can detect SARS-CoV-2 in low concentrations. Also, it is compatible with portable devices, useful for point-of-care applications. These are my main references. I would like to thank my advisor, UFPR, CNPq, and the research groups involved in the development of this great work. Thank you for watching.